Hello, this is Dr. David Greene, CEO of the Colorado Pain Network. Today the topic is what you need to know about facet injections. What exactly is a facet joint? Well, these are the small thumbnail-sized joints on either side of the spine at every level all the way from the neck down to the sacrum. They do have cartilage just like a hip or a knee joint, and even though they're small, there's a lot of them, so they combine to allow for an incredible range of motion of the spine. So what makes them painful? Well, these joints are prone to arthritis just like any other cartilaginous joint. Even though they are small, they can cause a heck of a lot of pain when they're arthritic. Typically, it will lead to pain in the vicinity of the joint that's arthritic, but unfortunately, when a person has one joint that is arthritic, and see how the ratty appearance here, they often have two, three, four, even more that are arthritic. Okay. So here's a picture from the side looking at the spinal processes. You can feel these bumps on your back. These are facet joints. See how this one looks nice and clean? This one looks very inflamed and a lot of overgrowth of bone and soft tissue. That's what we're talking about there. So why are facet joint injections performed? Well, for symptomatic facet arthritis, there really is not a great surgical answer. Because think about it, if you have multiple facet joints that are arthritic, one option would be to do a fusion, but what, are you going to fuse the whole spine because there's arthritis? That's a terrible idea. So there are excellent non-operative options, and facet joint injections are one of them. Similar to other joints that have arthritis and do well with steroid injections, facet joints respond well to them as well. So it's an outpatient procedure. It only takes about 10-20 minutes. Modern pain doctors will use fluoroscopy or ultrasound for imaging guidance. Usually sedation is not required. The skin is numbed and the soft tissue is down to the facet joint area. The needle is placed into the joint and dye is placed to make sure they're actually in the joint, and then the steroid and numbing medicine are placed. Several levels can be treated at the same time, and the procedure can be repeated every few months as necessary. How well do they work? Well, studies show that 82% of patients receive pain relief over 50%, and significant functional improvement was also seen in close to 80%. And that's whether or not steroid was used. The average duration of pain relief is close to 4 months. The same results were also seen in a study from 2007 and again in 2008, confirming it. So the procedure is an excellent non-operative method of achieving neck or back pain relief due to spinal arthritis. Well, what happens if the pain comes back? There are 3 treatment options if the pain returns. One is to simply repeat the facet injection. The second is to perform a medial branch block, and what that involves is not going into the joint, but going around the joint where these little medial branch nerve endings are, and that can numb pain as well. The third option is to do a radiofrequency ablation, which involves heating up the area around the joint to deaden these little nerve endings, and hence pain. That can provide pain relief for 12 to 18 months. It's incredible. The average pain relief for the medial branch block is 3 months. Are there risks with facet injections? These are very low risks. There's a slight risk of infection, bleeding, allergic reaction. The needle does not go into the spinal canal, so there's really negligible risk of causing a nerve root issue. Colorado Pain offers comprehensive pain management at several locations in Metro Denver, Golden, Buena Vista, South Granby. Over 50 insurances are accepted. The pain doctors are board certified and have won the Patient's Choice Award 5 years in a row. Call today for help with your pain relief, 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. David Greene, CEO of the Colorado Pain Network. Your pain stops here.